It's not always an easy process. Word of mouth is one way that families can find a provider. They can ask their friends and families who they see for their medical care and ask them how they feel about the experience they have with that provider and if that provider responds to their concerns, just to get some additional information. They can also talk to their pediatrician and or their subspecialists and ask them if they have any names that they may provide or recommend for adult care. Then once they get these names, they need to call the healthcare plan and confirm that they are in network with their health plan. And that is to make sure they don't get an unexpected out-of-pocket payment. They want to be in network, so that's the lowest or the best coverage that their insurance provides. Then once they also find that out and they call that provider to make an appointment, they also just want to confirm with the office that they're still accepting that insurance. Because our insurance system is very complex and there's a lot of changes that happen kind of quickly. So just to kind of cover all bases. In addition, once they have gone to their appointment with their new provider, if they're not satisfied, they do have the right to make changes. And their health insurance plan can help them with that, or they have to start the process over, which is frustrating, but it may be well worth it if they're not a good fit. In addition to that, when we have health insurance, we're issued a health insurance card. And on the back of that card is generally a customer service number. I myself have used mine quite a bit and found those people very helpful. So you can call them, explain the situation that you have, my young adult, or if it's a young adult calling, aging out of pediatrics and need an adult care, primary care doctor and or specialist. And they can help generate a list and they can filter it by how far you're willing to drive for appointments, if you want a male or female physician, what language, and if they're accepting new patients, they can generate that list and send it to you. And then you can, the parent or the young adult can then start looking up those names and seeing what might work. And also, they may go on the website directly for their insurance and also navigate directly through there so that they can find information out. Once they have it names, they can always put them in Google and search for kind of what we call health grades to see what kind of feedback that individual has had on their postings. It's not a perfect system, but it's a place to start. It takes a lot of persistence and a lot of patience, but it's well worth the energy up front.